Welcome back to AM Northwest. If your dentures make talking more difficult and eating less enjoyable, our next guest has a much better option. We're happy to welcome back from Sleep Dentistry Defined, Dr. Heath Lampee. Always good to see you.
Thank you, Helen. Appreciate it.
All right, so let's talk about who are the people that need dentures for the most part.
A lot of patients lose their teeth early or in middle life because of gum disease, cavities, soft enamel, because they didn't have dental care when they were kids.
Right.
So they lose their teeth and they get dentures. But we all know that nobody really wants dentures anymore.
Right. It's embarrassing.
It is.
They slip and all of that.
Yeah, I mean, if you go out to a restaurant, you may have to retire to the restroom and go clean them out because you're getting a bunch of stuff underneath them. You will have to order soup because you can't have the steak.
You can't eat any hard things, right?
And maybe if you're at work too, maybe you're not confident. Maybe you won't get that promotion as well.
Right. So your solution is implant dentures.
That's right.
Right. And how do they work? Because there are two different kinds.
That's right. We have two different kinds of implant dentures. Okay. There's one kind, so both kinds involve putting implants in the jaws. We usually do 4 implants on the lower and 4 implants on the top for good security, basically. Sometimes we'll do 5 or 6 for a lot of security. Right. So the two different kinds.
Is that a bigger mouth? Is that why?
If someone has enough bone, we can do extra implants. A lot of people are lacking the bone. So.
Okay, gotcha.
So the two kinds, there's a kind that snaps in and snaps out that's really, really strong. They're made out of acrylic, and they don't, so there are the 4 snaps there.
Right.
And what we'll do is we'll actually snap in a prosthetic in there that has all the plastic gone from the roof of the mouth so patients can talk better, taste their food, feel better. That thing is strong in there. You've got to really kind of like tug on that to get that out.
Wow.
And the great thing about that is you'll take it out 1 or 2 times a day in the privacy of the bathroom, clean it, and put it back in.
So just like you brush your teeth?
Yeah, basically, yeah.
So you don't have to, like I remember my grandmother and the glass, the glass next to her bed
the glass
with the dentures in it.
Just don't do that.
Yeah, that would not be attractive.
Nobody wants to do, nobody wants to do that.
Right.
So that is our one type of implant denture, snap in, snap out, and I would say about 70% of my patients do that.
Okay.
About 30% of my patients want the ones that screw in permanently.
Oh, wow.
That only I can take out. Now that is an all ceramic implant denture, and it's actually made out of something called zirconia, extremely strong, extremely durable, and so that is screwed in permanently, and patients have the most amazing confidence with that.
Wow, look at that.
For a patient who lost all their teeth to have a new set like that, and it's screwed down on 4 implants, he's going to have that the rest of his life, and he is so happy and thankful that he doesn't have to deal with a lower denture anymore.
Wow. So how does he take care of the teeth?
So he'll use a water pick, which is a little device you can buy like at Target or Walmart. Right. Use that every day. You'll use Sonicare toothbrushes. Once a year, I'll inspect it to make sure everything is doing all right. Every now and then, we may need to take it out, clean it, and then screw it back in.
Right.
But it just needs to be brushed and flossed like normal teeth.
And the fact that you can sleep in it.
Yes.
You go to bed with it, wake up with it.
Yeah, you don't have to take it out. And really, it's about life-changing confidence for these patients because they've dealt with dentures for so long.
Right.
And it makes a lot of people feel debilitated. They don't want to go out. They want to avoid social situations. And so by giving them these implants, whether it's snap in, snap out, or the screw-in permanent ones, we're totally changing their lives.
Yeah. Doctor, really, it's really impressive. We want to tell folks if they'd like to find out more, contact Sleep Dentistry Defined, 503-646-2273. We'll put the information for you on our website at k2.com. Thank you.